Now, about 3,173 Nigerian-trained nurses and midwives moved to the United Kingdom in 1 year. As Nigerian health professionals continue to be drawn by the lure of Western world, the trend is putting the sector in more jeopardy. According to a report, a total of 3,173 Nigerian-trained nurses and midwives moved to the United Kingdom in 1 year. The latest report from the Nursing and Midwifery Council shows that the UK registered the number from the 1st of April 2023 to the 31st of March 2024. The report also indicates that so far, 13,656 nurses and midwives educated in Nigeria are practicing in the United Kingdom. Jide, there's fire on the mountain.
Yes. And you know, this problem is not peculiar to Nigeria.
Yeah.
In Europe and America, they are looking desperately for health professionals.
Yeah.
Pharmacists are leaving. Laboratory technologists are leaving. all professionals, all the professional groups within the health sector, they are leaving our country. Doctors too are leaving. You know? So we really need to do something because, one, the WHO says we should have 23 doctors, nurses, and midwives for 10,000 patients. In our country, in northern Nigeria, what we have is 45,000 patients to a doctor. So, yes, 45,000 patients. They are heavily overworked. The pay is not encouraging. They know that having been trained, there is a need to recoup what your parents spent on you, training you. So they want to go abroad, work, and be in position to take very good care of their parents. And beyond that, insecurity is also a factor. When Boko Haram attacks communities, they're always looking for nurses. Because those nurses are the people who...
Even in their camp, they want to require their services.
Yes, yes. Those doctors who take
like first responders.
And the same way they look for doctors. There was a doctor who was kidnapped in that train kidnap. He had just been released from captivity. And then that one happened. You know? So nurses know that their lives are not safe, especially those practicing in northern Nigeria. Kidnappers, bandits, and Boko Haram insurgents always look for them to kidnap so that they can use them in their camps. So what we are seeing is a situation in which in just 5 years, about 16,000 doctors have left Nigeria because of inadequate funding of the health sector, inadequate funding of infrastructure in the health sector, and lack of medical opportunities for medical research. Given how important doctors are, they are described as the heartbeat of the health sector. They are usually the first person that the patient sees. They calm the patient down, they prepare the patient for difficult procedures that are ahead. Before the before the doctor even comes to then prepare you for surgery, they will have been talking to you, working on you to
take
calm
your
you down.
BP,
So
vitals.
they are doctors can't function without them. If we continue to lose them, there's no way it will not have a telling effect on the overall healthcare delivery in our country. And so there's a need to stem the tide. The kind of money now, even UAE recently increased salary paid to foreign health workers.
From time.
That,
Saudi Arabia,
yes.
UAE, they've been...
But the UK, for our own people, UK and USA, those are the places they go to mainly. And so the brain drain, when they first happened, it was to Saudi Arabia.
I remember.
Our doctors then.
Yes, so I remember.
Because the kings of Saudi used to come to UCH to receive Medicare in the 70s. the 60s and 70s. So the moment things turned around, they knew that Nigeria had some of the best health professionals. So they began, that brain drain was actually from the Saudis. But these days, many countries are offering a lot more. Denmark, Canada, USA, you know, so they are going there. I don't think that we can do anything to stop it.
As much as £6,000.
Even Egypt. Egypt came up with a law. It was such a problem in Egypt. They came up with a law that you must first work within your country for a number of years before you can move. And but it still didn't stop it.
Sonny, unfortunately for us, or fortunately, you know, our government will subsidize this sector. It's heavily subsidized, as in what it takes for you to become a medical doctor. In terms of training and even nurses. So you can't compare it to what you have in the US. So that's why you see a lot of people, they train here, they still fit into their distance there.
Well, this scenario has persisted over the years. But I think that it's time for the government of Nigeria to take necessary steps or measures to be put in place to check this, because you cannot continue to train for other countries. And training one health professional is expensive.
If you go to a private school now, you see what they are charging for medicine.
Okay. So if Nigeria does not mind that it will continue to train medical professionals and leave them for other countries, it is a setback. It's an economic loss. Even though from the reports that we read here, Babajide, they are still saying that Nigeria still has 826,000 nurses. I don't know, it's included in that report. And sometime...
You know?
Yes, at the moment.
We're blessed.
And that Nigeria is one of the 55 countries contributing more medical personnel, nurses, midwives, to the UK. So it cannot continue like this. The government must be worried at certain points, and some steps need to be taken, because the countries that are taking Nigerian health professionals for their own interests, these are the same countries that have very stringent laws working against Nigerians. Some of them would not give you their visa ordinarily. So they are exploiting us in some ways. Even though economically an individual has the right to migrate to where he or she can find greener pastures. There's nothing wrong with that, right? But for a country that does not really have enough, because these things that we are talking about, when you get to the villages, you will find that we don't have enough doctors and nurses.
We don't.
And people are suffering. And this is why Nigeria is easily plagued by avoidable ailments.
Preventable.
You still hear of cholera, you still hear of measles.
Even malaria.
It's things that other countries now taking our health personnel. These countries have overcome these preventable ailments. So it is time for our own governments to come with appropriate measures to stem the tide of this exit.
Jide, when you look at the perks involved, you will check that, Nigerian government, they can always try to improve their welfare and everything, but what they are paying them in the US and UK, if they are paying a nurse in the US from $5,000, calculate it. That's it's over 7.5 million naira a month.
It's really now that
$700
is more than a million naira.
Do you understand? So there's somehow we can meet in terms of benefit and everything.
Yes,
but the government can also pay.
They
must step up.
Reduce this thing. We must not allow it to degenerate. Even during COVID, when it was difficult to travel, Thousands of doctors
US,
still
they,
left Nigeria.
they were given 24 hours visa.
Yes.
Thousands of doctors they still left. And you know that time, the health system over there was overwhelmed.
Exactly.
Overwhelmed because of the deluge of cases. So Nigerians were leaving during COVID to go and work in UK and the US. I know that economic migration is not what anybody can stop. There is no law by which you can use to stop economic migration. But we have to do something to bring this down, to bring down the rate at which people are living. You know, if we don't bring it down, we'll run into an emergency at the rate we are going. Because nobody wants. In those days, Ayo, it used to be consultants, senior people living.
Yeah.
Even when we were talking about specialists, brain drain, they were the senior people. Today, somebody in medical college, before he comes out, is already thinking
Doing that exam.
I remember a guy that I met in Benue. We were discussing this matter with his wife, who is the hairdresser. We were discussing this matter, where are we heading to? Then when I got back to Lagos, he sent me a WhatsApp message. He said, I'm sorry. I know you'll be disappointed to hear this, but I didn't have a choice. So I knew that he was preaching against it. He was actually plotting how it will live. So this next day said, I have gone.
Yes.
So they are in medical college, they are already thinking of going.
I'm sure
they've not had the experience here, but they are already thinking of going.
That time, recently, that exam that they do to convert, you know, it used to be something around 1 million naira, close to 1 million naira. Even if the thing has, the amount has traveled, now people
they will still find a way to
It's what the trouble.
Do you remember the exam that they were going to do here in Abuja?
Yes.
Some of the young doctors reported seeing their prof.
Yes. Yes.
They came for the same
Specialists.
Yes, so
Came for the same exam.
young graduates.
Yes.
They saw their own
prof.
person who trained them. It was preparing to move. And it was such a big crowd. I think invariably government stopped that thing because it was such an embarrassment. The place was
DSS.
You guys do your prof. You do your dean.
It's not like in other sectors, Sonny.
Yes.
Look at our lecturers, the same trend. Look at our other professionals, the same trend.
Yeah, because you see, when I don't think that we really place any value on even teachers, because in other climes, teachers are highly rated, and before they get you out of the system that you are a teacher, you are seen and rated as a professional with respect. But here, if they say that you are a teacher, you are a professor, you are this, as long as you are in the academic system, I don't know how they rate you. It doesn't make real sense. So
they too are not staying, no. They too are running away.
The people have to move
they
to where they are well respected.
They travel out on TED funds.
Yes, and
they don't come back.
They look from there.
So it's even a big problem too in that sector. You use our money to go and do research.
And Jide, why has that happened? Because the laws are not in place to deal with these people who elope. The law should be in place.
Even universities in Accra, Aflao, Togo, Republic of Benin, are crowded with our people there.
Yes. And when they go to sign agreement, take up job there, do the schools, don't they check, okay, are you under obligation to your country to return or not? They don't check such things. And the people who train them, that the money they use in training them, have they repaid the money? Or maybe it is free. Say, okay, once you finish, go. I know of a state that when they were about to start the state university, they sent out some citizens to Canada, to UK, to Europe, America, Asia, but not up to 10% came back till today. And the university has to look for other people with them. But because the governor who initiated that didn't put any condition. They just say, go, when you come back, you run the university. And when they went and saw better opportunities, they went away to say,
no, they will always exploit a loose system.
So something should be done to make sure that if you are under obligation, you must come back to discharge it.